one of the biggest advocates in Minnesota, one of the, I would say, most persistent advocates in Minnesota for a single-payer health care system has been Senator John Marty, and he joins us now on the line. Senator Marty, welcome to the program.
Glad to be with you tonight, Mike.
Glad to have you here. I know this isn't what we're going to talk about it, but any reaction here to the nurses' strike settlement?
Well, largely relief. It's wonderful news. The nurses were being hit to give back massive take-backs from the hospitals, and to avoid that, I think everybody wants to avoid a strike, and I'm glad that it looks like they won't have one. It still doesn't solve the staffing issues, which I think the nurses have been raising more and more concerns about over the years, and I think they may be coming to the Capitol to try and make sure that we begin to address them. But it's good news that there's not going to be a strike right now, and we can address the other issues in the future.
I assume that if the nurses come to the Capitol to talk about legislating on this, that they're going to have at least your ear at least to listen to it.
Yes, it was interesting the day of the one-day walkout. I talked to a nurse who at Fairview Riverside, she said she was an operating room nurse, and she said in her 8 months there, she had gotten more of her breaks than she had gotten in 16 years in another part of the hospital. Why? Because federal law basically mandated they had to have replacement nurses for break times and so on. Otherwise, without specific rules, she said she was working through lunches, she was working through breaks day after day after day because they were just so understaffed. And I think those are issues for patient safety we have to come to terms with. And I'm sure that if it didn't happen through the bargaining table, that we'll be taking a look at it at the Capitol as well.
Now, on another healthcare-related issue, Governor Pawlenty has in his power right now to be able to sign a piece of paper and say, okay, we are going to get what amounts to, I believe, $1 million a day from the federal government to help us with Medicare here in Minnesota, but he's refusing to sign it. Am I giving an accurate statistic there when I say it's about $1 million a day?
I think that's, I haven't checked recently or haven't broken it down by day, but it's a lot of money, and why we turn it down is a really good question. The state's not what you'd call flush with money, and we're not getting our fair share back from the federal government anyway, and so when they offer to do it, I'll be surprised if other states are as foolish as our governor wants us to be.
I mean, other states have stepped in and have taken this, haven't they? Or are we the first one that...
Well, it's kind of foolish. I mean, what kind of point is he trying to make? It's helping our people get the health care that they desperately need, and getting it from the federal government, money that we paid to the federal government that's used for this purpose, and saying, well, we don't want it. I don't think there's a lot of good logic there. Representative Tom Emmer, who is running for governor on the Republican side here, has apparently wants to continue Governor Pawlenty's policy. He was putting out what he called a debunking of the statement that Minnesota is going to receive $7 back from the federal government for every dollar it puts out on this. Basically saying that, well, you know, he does the math here, but the way I see that he's doing the math, he is not including the expense that we already are on the hook for here in Minnesota. That's not going to go away. That's the health care that we have to pay for. That's the weird, bizarre thing that they've been using in their logic is if we don't pay for health care for very sick people, they'll stop getting sick. And it just doesn't work that way. When the governor vetoed the General Assistance Medical Care Program and unallotted it for a couple more months a year ago, that really caused a crisis. And not a crisis because of a budget problem, but a crisis that we take 35,000 of the governor's own staff acknowledge the sickest people in the state, we take away their health care, and we somehow think they're going to stop getting sick. No, we're going to end up paying the bills. Taxpayers will. They'll end up paying it through, some of it will be through higher local property taxes. Hennepin County Medical Center is one of those public hospitals that gets very hard hit by it. So taxpayers will pay for it that way, and all of us will pay because we'll be paying higher rates to the hospitals to make up for it in other ways. So it's not like there's no cost. It's if people don't cost anything for health care, if we don't spend anything, they'll be in the emergency rooms and we'll all be paying for it, and they'll be clogging up our medical system.
Now, you went and threw your support behind Margaret Anderson Kelliher, who eventually got the DFL endorsement for governor. She's running in a primary, but you put your
Right.
support behind her because she was willing to step up the plate and say she is going to push for single-payer health care here in Minnesota. There was an article that was not an article, but a story that Minnesota Public Radio put out recently about that, and you wrote that you were disappointed with that story. Can you tell me why?
Sure. Well, it's not that politicians haven't backed out of promises they make. I mean, we know that all the time, or you don't have to look further than the current governor's office to see that happens frequently. But the thing in this case was the reporter, in my mind, didn't give any evidence that she was backing away from her pledge. And I've talked with her since then. I've talked to her before then. I see no evidence that she's backing away from it. The evidence he had used was that she was now calling for a cost study, and she hadn't been calling for one at the state convention. Well, she has been, I mean, I've been, as the author of the bill, I've been saying we need a cost study. We've been working with the foundation who's agreed to put up part of the money. We've been working to make it happen. We've been saying we need one, and so for her to say she thinks we need one too is not, in my mind, it's not a delaying tactic. It's not a backing away. It's simply acknowledging what I think I might call myself the strongest proponent of my bill, is saying we need as well. I didn't see that as backing away. And the other thing he had used to argue that was that she's saying her plan is to make sure it happens within 4 years. And at the convention, she said, she wrote me a letter saying she'd love to sign the bill within 2 years, which is the period I was saying I hope we can get the bill signed within 2 years. And to me, you know, if we get this passed in 2 years or 4 years, it will be, I won't say miraculous because we've got to have to make it happen, but it'll be first state in the country to do it. Something people were saying, telling us 2 years ago, you don't have a chance of this happening. And so I'll consider it a big victory, 2 years, 3 years, 4 years. And when I talked to her at the state convention, I told her I think 2 years is going to be incredibly tough. And she said her goal was to make it happen as quickly as possible. And so I haven't seen any evidence of her backing down. I'm very pleased. When she first committed to the bill last November, I was kind of surprised, but she's been gaining in strength on it, and she understands the bill now. She recognizes it saves money, not costs more. It keeps people healthy. It's the only plan out there that covers everyone. And it's the only plan that saves money. So I'm thrilled that she understands it. I'm thrilled she's made the commitment. And my disappointment with the story was that it implied she was backing away from it. And I've seen politicians back away from things many times, but there's no evidence here that she has.
I'm curious, from a media standpoint, did you get any response from public radio when you wrote them about this?
Yeah, he told me he's sorry we agreed to disagree. He said he sensed a change in tone and so on and thought there was some backing away. And I told him, well, I haven't, in my conversations with her, I haven't seen it. My hearing her in the media and in person and from others, I don't see any evidence she's backing away from it, and I'm thrilled with that. I got to say, I think it's critically important. When I threw my support to her at the convention, I said this is bigger than any candidate. It's bigger than any person. It's truly a life and death issue for thousands and thousands of people. And we got to have it so people don't die from a lack of health care in this state anymore. And with the Minnesota Health Plan, we can make that a reality.
We're talking with Senator John Marty here, one of the longtime supporters of single-payer health care in Minnesota. You are welcome to join in on the conversation, 952-946-6205. I see we already have people on the phone. Let's go to Todd from Ramsey, who wanted to talk, I believe, about what Tom Emmer has had to say on this topic.
Yes, thanks for taking my call. And Representative Marty, I'm a longtime supporter and appreciate your position on many things. What I'm calling about in particular was the recent op-ed piece that was in the Sunday Star Tribune, where Representative Emmer was talking about, and this is not a quote, but this whole thing about the states should be making a decision whether they want to opt in or out of federal laws. And in particular, he threw out that old saw that the conservative use, that a current example of how the federal government is overstepping its authority is they're going to be forcing medical decisions on us with the new Obamacare law. Can can you throw some light on that? Whether that is or is not true, are they going to be making medical decisions for us?
Yeah, I don't think that's the bizarre thing. They're talking about that. Right now, the frustration in my mind is that the people who are making most of the medical decisions seem to be health insurers. Health insurance plans making the decisions. I don't think government or health insurance plans should be making the decisions. I think it should be up to the doctors and their patients. And if that's Emmer's true concern, I urge him to join us in supporting the Minnesota Health Plan, which gives every patient the right to choose their doctors, their hospitals, and the decision in making it leaves them up to the doctors and hospitals. But this whole thing, it's kind of like the talk that Sarah Palin and Michelle Bachmann and others were talking about death panels. Last summer at the State Fair, some senior citizen came up to me and said he was scared of the Obama health care plan because it meant he, as a 70-some-year-old guy, was going to have to take a black pill. I didn't know they made pills in black, and I assumed he meant something like cyanide or something, but I asked him where in the bill this thing was. And he said, oh, it's in there. And I said, I don't think so. And he said, have you read the bill? And I told him I honestly hadn't read the bill. I'm a state legislator, not a federal lawmaker. And I asked him if he had. And he said, oh, yes. I asked him if he'd send me a copy of the page that showed that you're going to have to take a little black pill. And he kind of walked away with that. But, yeah, that's Emmer's kind of thing. It's scare people. The health care plan in Washington basically is more of what we have right now. It's going to be more people are going to have insurance, which I don't think is the right approach to fixing the health care problem. But in the short term, it means millions of people will have something they didn't have. And saying that means that the federal government is going to tell you what kind of health care you get it's just, I mean, you can make up anything you want to say, and it's hard to, you can make up whatever you want to repeat it enough, hope people believe it.
Todd, thanks for the phone call. John, we're talking with Senator John Marty. We got to take a break here, and when we come back, we'll take more of your phone calls. Richard's on the line. We'll get to him. Your call-in number 952-946-6205. You're listening to Quick on the Uptake. We're speaking now with Senator John Marty, who we've been talking about health care, and Richard from Harris has been hanging on the line very patiently to talk and ask a question. Richard, what's your question or comment?
Good afternoon, Senator Marty. Thank you for taking my call. I had a question concerning if we pass single-payer health care on a statewide level tomorrow, what impact would that have on businesses? And specifically, would this make Minnesota then more attractive to manufacturing jobs, all manner of jobs coming into the state?
Richard, thanks.
Richard,
thanks for the call.
Yeah,
there.
I think that's exactly one of the things it would do. Is I spoke down in Albert Lea and Owatonna this week on this to Chamber of Commerce related groups. The Chamber sponsored both events, I guess, or partial sponsors of them. And I think one of the reasons we want to talk to businesses is because this is so important to businesses. They are struggling right now with the cost of it. I think one person a few years ago pointed out that American auto industry spends more money on employee health insurance than they spend on steel for American cars. It's like we put a tariff on our own vehicles and wonder why we can't sell them in other countries. You know, it's a real competitive disadvantage, and I think that having Minnesota Health Plan, single-payer health care pass in Minnesota would be the single biggest thing we could do for businesses. I think it was last February there was an article in the Star Tribune, a survey of 180-some businesses in Wisconsin and Minnesota on what the biggest burdens they have to expansion are. Right, coming out of the recession, we want businesses to expand, hire more people. The number one reason they weren't able to expand is health care costs. Oh. Trying to cover their employees, and you take on a new employee, you got more costs to deal with. So I think your point is exactly right. It's not only helpful to business, it's probably the biggest single thing government could do to help businesses thrive.
Yeah, we need to get health care off the backs of businesses, to kind of paraphrase some of the politics that usually get said about this subject. We have a question here that came in from our live blog. Somebody asks if Mark Dayton, if he were governor, would he
get single payer through the legislature faster than Margaret Anderson Kelliher would?
Well, Mark is at time last year he was committed to passing the Minnesota Health Plan. Then he decided, well, he favored single payer, but at a national level, he does say he'll support it. I would say that I think he'll be a supporter of it as well. I think Margaret has decided she's going to put all her weight behind this, and all of her campaign is saying we support this and we're committed to making it happen. I think the good news is Mark, I think, would be pushing for this too, and he's been talking more in terms of national single payer now. But the reality is, I mean, he was in the Senate. He knows it's not going to happen in Washington right now. The politics are just too extreme, too deadly, and with the Citizens United Supreme Court ruling, corporate money is going to be even bigger and bigger than ever there. I think it's going to happen in the states. But I would count Mark as a supporter, which means 2 of the 3 Democratic candidates are supportive, but Margaret's been very clear on it.